The first Teaching Innovation Prize winner is the Caring with Compassion project, led by Dr. Davoren and involving an impressive team of medicine, nursing, and Michigan Creative.
Advanced medical learners often have a very large challenge in front of them caring for these at-risk patients, and particularly because their schedules are already so full, they really don't get the opportunity to participate in organized classroom education the way they used to when they were at earlier stages of their training. So we're talking about late-stage medical students who are on the clinical wards, residents and fellows, so interns, residents, and fellows, people who have already graduated with an MD and are now under supervised practice, and also advanced nurse practitioner students who are in clinical rotations. And these are folks who tend to be spread out all over the clinical campuses and have a variety of work hours as well. So they really needed a creative approach to providing them with an organized content for the education and also ways to interact with that content. I'm working with a team of folks from the nursing school, medical school, and also the Department of Social Work through the University of Michigan Health System. And we created a curriculum to help advanced medical learners in caring with the most at-risk populations that they tend to work with. So folks who are homeless, uninsured, or at risk for uninsurance, underinsured, or having difficulty with a stable employment income. Essentially folks who are socioeconomically disadvantaged in the health system. So we approached this by creating first an outline of the major knowledge content areas that would be helpful for them, broke it down into a couple domains, the overall structure of the health system and issues regarding public health insurance, public health models, and also the epidemiology of the homeless and underinsured populations. And then the second domain being more the biopsychosocial approach, what we call social determinants of health, and biomedical concerns, and also the team care aspects of caring for this population. Put those two domains into a knowledge framework, created knowledge content around all those domains, and then created an online resource where people could go in and learn about these content areas, the socioeconomic and socio-behavioral content areas, in an online case-based session. And then supplemented that with a learning game that allowed them to take what can be a fairly weighty topic and to interact with it in a lower risk, enjoyable, fun model. And then supplemented that further with faculty resources so that faculty all over the country can access this curriculum and use it to support their learners in clinical settings, using evaluation tools, clinical feedback tools, and so on. So it's really turned into a curriculum that is not only used here in the medical center for medical students and residents and nurse practitioners, but in fact all over the country now as a core resource in training advanced medical learners in approaching the biopsychosocial domains of care.